Hello, I'm David Herman, and I have the privilege of being the CEO of Essentia Health, and I'm here with some of my colleagues. Chad, would you introduce yourself?
Yeah, hi, my name is Chad Nerman, and I'm the Director of Support Services for Essentia Health.
And I'm here with Dustin.
I'm Dustin Rogers. I'm the sous chef at Essentia Health.
And we're here in this beautiful new facility. We're here in the kitchen, and as we know up here in the Northland that food is love. Can you tell us a little bit about the kitchen and how it's been designed?
Took the models that we're using now and then looking at, implementing them here in this, much larger, more efficiently designed space. And really what we were looking to do is provide a system so that we could feed our patients quickly and give them great service.
Have you ever been in a kitchen that had views like this?
Never.
All right.
Never had a kitchen with windows.
All right, so you think that's going to be really an attraction for you to get the best staff?
Yes.
Are we going to be having food that's locally sourced here?
Yeah, definitely. We currently do, and with the new space and expanded salad bar, we'll have more opportunity to explore that, as well as using local vendors for our coffee.
Between the executive chef and I, our goal is to have this be the place to eat in town that you tell all your friends about, and we can do that by using the freshest ingredients possible. This is nice and open, new equipment. It gives us even more ideas of what we can produce out of here having the space.
It'll be just like a restaurant, so we're exploring technology as to how they'll order that food, using in-room technology potentially, and then they'll basically order what they want that's compliant with their diet. They'll phone it down, and then just like a restaurant, we'll create that food and send it up as soon as possible.
Chad, a lot of our patients have dietary restrictions or dietary preferences. How has this been designed to meet those preferences and those needs?
We have software that allows us to understand what those needs and restrictions are, and then with this larger space, we'll be able to have dedicated space if people are gluten intolerant and things like that. So we have a healthy eating station over here that will be focused on more fresh items. That's where we'll probably utilize some of the farmers markets items. The flow kind of wraps around the outside. Over here we'll have a typical grill station that will be able to offer items made to order, as well as have some specials. We also have an entree station that will be like a carb station, typical, a lot of that comfort food that we talked about up here, and so that's where we'll serve those items. And then in the center here we have a giant salad bar. So our salad bar, healthy, fresh, it's one of our most popular items. It's a 30-foot salad bar.
We have a very fancy pizza oven here. Can you tell me a little bit about it?
So it's a brick-fired pizza oven from Italy, handcrafted, that will be able to make pizzas very quickly to order. So, we know that, freshness is key with food, and so a lot of this equipment was catered around being able to mass produce things quickly and not having to pre-make a lot of things and compromise the quality. So we know that our staff, our visitors, our patients, they need a break from maybe what they're doing here, right? It can be stressful, and so to be able to design a space like this, to take a reprieve, to just step outside, get some fresh air, and then be able to enjoy these views. A lot of our staff will be entering through this way, and like I mentioned, we have stations on the exterior, and so people will come in here, grab their trays. We'll have digital menu boards available, so where to go. So we haven't come up with a name yet, but we did want our staff to have input into that. So we held a contest where we elicited recommendations from staff. We had over 550 naming choices, and so now we're in the process of whittling that down.
When you're a patient in the hospital, you don't have a lot of choices about the care that you're going to get, or you certainly probably didn't choose to be in the hospital unless you're here for a birth or some elective surgery. Yet food is love, like we've talked about, and I understand you've built some choices into that.
Yeah, for sure we have. So we know that hospital stay in many cases isn't pleasant, and you don't have a lot of choice, and so what we allow is our patients to order what they want when they want.
So Chad, I know it doesn't look like it right now, but this is going to be a coffee shop.
We know that the importance of caffeine for healthcare workers, and so this is gonna be a full-service coffee shop. We'll have specialty drinks, also serving sandwiches and salads and some of those types of items.
So we've had a tour of something that's very important to us all, and that's food here at Vision Northland. I want to thank Dustin and Chad for accompanying me on this visit and helping me learn a lot more about this. And every time I'm here with somebody new, I get just as excited as they are. So I want to thank you for fueling my excitement on this. And all of us here at Essentia Health are extremely excited about what this means for our patients, our staff, and our communities. And thank you for watching.